Okay, so we're gonna do the hip external rotators, and the muscles are gonna be your piriformis, quadratus femoris, obturator internus, obturator externus, gemellus superior, and gemellus inferior. So for your piriformis, the action is gonna be laterally rotate and abduct. It's gonna originate on the anterior surface of the sacrum and inserts on your superior aspect of your greater trochanter. The neurological level is going to be your sacral plexus, L5, S1, and S2. That's your piriformis. And then for your quadratus femoris, its action is going to laterally rotate. All of them are going to laterally rotate. Origin is going to be the lateral border of the ischial tuberosity, and it's going to insert on the intertrochanter crest. And neurological level is going to be the sacral plexus of L4, L5, and S1. And then your obturator internus also laterally rotates, originates on the obturator membrane, and inserts on the medial surface of the greater trochanter. The neurological level is going to be L5, S1, and S2. And then for your obturator externus, going to laterally rotate. Origin is going to be the rami of the pubis and ischium. It inserts on the trochanter fossa of the femur, and neurological level is going to be L3 and L4. Gemellus superior is going to laterally rotate, originates on the ischial spine, inserts on the medial surface of the greater trochanter. Neurological level is going to be the sacral plexus, L5, S1, and S2, and also with the gemellus inferior, laterally rotates, originates off the ischial tuberosity, inserts on the medial surface of the greater trochanter, and neurological level is going to be the sacral plexus of L4, L5, and S1. So those are all your hip external rotators. Some compensations to look out for is patient flexing her hip, or hiking her hip up as well. Grades, if she can do it by herself, it's a grade 3, and with resistance, it's going to be a grade 5. The movement, what's going to happen is patient's going to stay like this. She's going to be seated off the edge of the table, and then she's going to bring her foot in, and I would give some resistance. So yeah, if she can do it, grade 3, and then with resistance, grade 5. And then, oh yes, my stabilization hand is going to be on the lateral side of her knee, and my resistant hand is going to be on the medial side of her ankle. So this is the uninjured leg, this is the injured leg. So Madison, if you don't mind, can you please bring your foot in, please, for me? Thank you. And right back up. Yep. So she can do that by herself. That's a grade 3. Let's do the same one over here as well. So bring this in. Yeah. Perfect. Then we're going to go over here. All right, and bring it in for me, please. All right, she can do that by herself, so that's a grade 5. And bring it in. And she can do that by herself, and that's also a grade 5. All right, next we're gonna do the rectus femoris. What this muscle does, it extends the knee, and it also flexes the hip, originates off the AIIS, and inserts on the tibial tuberosity. My patient is going to be sitting, and my stabilization hand is going to be on her shoulders, and my resistant hand is going to be on the anterior anterior surface of the distal part of the rectus. Compensations to look out for: her leaning on one side while she's hiking, her leaning back, using the table to push her. Grades: if she can do it by herself, it's a grade 3. With resistance, grade 5. Movement: what she's gonna do, she's gonna bring her knee to her chest slowly or hit my hand, and then I'll apply resistance as well. So just making sure you can see me and see her at the same time. So so this is her uninjured leg. So we're gonna start off here. Stabilization hand is gonna be right here. So Madison, can you please bring your knee to your chest? Perfect, and back down. All right, and go. And back down. Perfect, so that's a grade 3 and a grade 5, because she can do it by herself and with resistance. So just make sure you can still see me. Stabilization hand, making sure she's not rocking back, rocking forward. Perfect. All right, bring this knee to your chest. Perfect, and back down. And then same thing. Perfect, and back down. And that is the rectus femoris. All right, also, I forgot to mention, neurological level for the rectus femoris is going to be the femoral L2, 3, and 4. All right, so next we are going to do the TFL, tensor fasciae lata. Action is going to be flexes the hip, medially rotates the hip, and abducts the hip. My neurological level is going to be the superior group, L4 to L4, L5, and S1. Originates off the iliac crest and of the posterior, iliac crest of the posterior ASIS. Iliac crest to the posterior ASIS, and inserts on the iliotuberosity tract, iliotibial tract, my bad. Patient's gonna be supine. My stabilization hand is gonna be on her pelvis, and my resistant hand is gonna be on like the on her ankle, on the lower distal end of her lower leg. Compensations to look out for is gonna be patient hiking her hip up or hiking her back, using the table to assist her, or her using her forearms in that position. The movement is gonna be, she's gonna abduct her leg out, okay? So this is her non-injured leg, this is her injured leg. So Madison, if you don't mind for me, can you just bring your leg out to here, please? Thank you, and back down. And make sure you stabilize that hip and apply resistance, go again. All right, and back down. So if she can do it by herself, that's a grade 3. And she can do it with resistance, that's a grade 5. So same thing over here, and out. Perfect, and back down. And then go in, and back down. Same thing, grade 3, because she can do it by herself, and grade 5.